Welcome to this ASN Kidney 360 podcast. I'm Rita Chimgren-Podestuk, a general surgery resident at the Beth Israel Deaconess Medical Center. Today I'll be discussing our study published in Kidney 360 titled A Single Center Retrospective Study to Identify Causes of Sex Differences in the Living Kidney Donor Evaluation Process. What are the aims and methods of this study? Multiple studies have shown that females are living donors for kidney transplantation at higher rates than males. However, the underlying reasons for this observation are not well understood. Thus, we examined the living donor evaluation process to determine the point at which sex imbalance arises. We conducted a single institution retrospective chart review of 1,861 self-referrals for living donor evaluation between 2009 and 2022. Exclusion at each stage of evaluation was recorded and compared between sexes using log binomial regression. Unadjusted and adjusted risk ratios with 95% confidence intervals were determined, and we adjusted the risk ratios for donor age, race, ethnicity, relationship to the recipient, and recipient sex. What are the key findings of this study? Out of the 1,861 self-referrals, there were 1,214 females and 647 males. In other words, 65% were female and 35% were male. This resulted in 146 approvals and 125 donations, 61% of which were from female donors and 39% of which were from male donors. The adjusted risk ratios indicated no significant differences between sexes in completing medical or psychosocial workup, having medical or psychosocial contraindications, being approved for donation, and proceeding with donation. Therefore, we concluded that female overrepresentation in living kidney donation likely stems from a 1.9 times higher rate of self-referral, not differences in approval or follow-through. It is important to emphasize that males are not more likely to be declined as donors due to medical contraindications, contrary to common assumptions. And thus, we believe engaging more males in living donation could expand access to kidney transplantation and reduce waitlist times. What are the limitations of this study? The major limitations of our study include 1. Its retrospective design, introducing the possibility of misreported information and selection bias due to the availability of data within our institutional medical record and OTTR database. 2nd, there were 146 approvals out of 1,861 referrals, resulting in a conversion rate of 7.9%, which is slightly lower than that reported in the literature. This is likely due to the strict selection criteria to ensure living donors were in excellent health, many of which have undergone changes since the end of our study period. 3rd, the study was performed at a single center, and so conducting a multi-center study spanning geographical regions is the next step in this investigation. How can the results of the study be used to change clinical practice or service provision? Our findings suggest that females are more likely to express initial interest in living donor evaluation compared to males. However, beyond this stage, males and females are equally likely to become approved for donation and to follow through. And thus, our findings imply that there may be an untapped pool of male individuals who are not currently being considered for donation, but would likely be eligible. Care teams should encourage kidney transplant candidates to discuss donation with a diverse group of individuals, including males, to maximize their chances of finding a living donor. Community-level initiatives targeting males to raise awareness and enthusiasm for living donation may also prove effective. Additional work via a mixed methods approach would certainly help refine these strategies and potentially expand access to living donor kidney transplantation, thereby alleviating the shortage of organs. We compared demographic characteristics between donors and non-donors of both sexes using female donors as a reference group. While there was no significant difference in race between female and male donors, a higher percentage of female donors were white compared to non-donors of both sexes. It is also important to note that white and non-Hispanic individuals are overrepresented in all 4 comparison groups, relative to the racial distribution of Massachusetts where this study was performed. These findings highlight the need for improved outreach to promote equitable access to care. Thank you for joining us for this Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.